Hello everybody, my name is Siti Sholihatun Nikmah. At this time, I will try to give my consideration about case study 17. Before answering the question, I will read the case study 17 and then don't go anywhere and stay with me, okay? Case study 17. Informed consent. Mr. S, a 56 years old male, consulted his family physician due to respiratory problems. After X-ray revealed pulmonary inflammation of the lungs, Mr. S was referred to a respiratory specialist, who determined that the condition was bilateral and recommended an open lung biopsy, which Mr. S refused to undergo. After Mr. S' condition further deteriorated, he was referred to Dr. D, an intern specializing in respiratory disease. Dr. D observed that Mr. S was exceptionally actioned upon examination. The doctor's initial diagnosis was progressive pulmonary fibrosis of the intestinal pneumonitis type, probably involving fibrosing alveolitis. A biopsy was required to confirm this diagnosis, but Mr. S continued to refuse to undergo an open lung biopsy. Dr. D then suggests an alternative procedure, known as a drive-in lung biopsy. This procedure was inferior to the open lung method. But in view of Mr. L's refusal to undergo to open lung biopsy, it was an appropriate alternative. Dr. D explained to Mr. S that the procedure involved administering a local anesthetic and then inserting a special needle into the lungs while the patient sat on the edge of his bed. He also told the patient the needle would be attached to a drill. Dr. D then outlined the procedure arranged, advising Mr. S that the procedure was usually virtually painless. But they have two possible complications. Dr. D did not mention to Mr. S that the procedure also involved the risk of perforating the spleen or the liver, an uncommon risk but not an uncommon space depth. Apparently, Dr. D was not aware of this risk. Mr. S consented in writing to the drive-in biopsy procedure. Prior to the procedure, Mr. S was anxious, apprehensive, and nervous. He told Dr. D he could not afford to die. He was given atropine and sedative, with normal and accepted doses of morphine. Once Mr. S had been sedated, Dr. D gave him instructions and demonstrated the equipment to him. After a local anesthetic was administered, the operation began. At a critical juncture, Mr. S was directed to hold his breath. Instead, Mr. S wheezed and moaned, causing his spleen to be perforated. Dr. D told Mr. S that the required tissue sample had not been obtained, but did not yet disclose that the spleen had been perforated. When Mr. S asked Dr. D what they had obtained from the biopsy, he answered something else. It soon became painfully obvious that Mr. S' spleen had ruptured and had to be surgically removed. This question is taking into consideration that Mr. S was an extremely actioned patient. Should the doctor have acted differently with respect to the explanation he gave to Mr. S? My consideration is yes, because Dr. D should have acted differently than he did. The patient was inadequately prepared psychologically for his required role in the procedure. Since Mr. S was recognized as an unusually anxious person, Dr. D should have won Mr. L's confidence through better and more effective communication. Dr. D gave instruction and demonstrated the equipment only after Mr. S had been sedated. The procedure should have been explained and the equipment demonstrated when Mr. S was in an unsedated state. Furthermore, this particularly anxious patient should have been prepared for this procedure through careful rehearsal to teach him how to hold his breath and refrain from moving. The statement Mr. S mailed to Dr. D immediately before the procedure, that he could not afford to die, was a clear indication of this apprehension. At that point, Dr. D should have evaluated Mr. S' willingness to process, which could have been tested only when Mr. S was alert and not under sedation. Every medical treatment requires the patient informed consent. The significance of this consent is that a person agrees to the treatment, the invasion of his body, understand the significance of this medical condition, of the meaning of the treatment, the danger and the benefit inherent in the treatment, and grant his informed consent willingly and without coercion, as determined in Article 6(1) of the Universal Declaration on Bioethics and Human Rights. Any preventive, diagnostic, and therapeutic medical intervention is only to be carried out with the prior, free and informed consent of the person concerned, based on adequate information. Informed consent is a doctrine which was developed by courts over the years and is encouraged in law in certain Western countries. This doctrine strengthens mutual patient-patient trust and respect by helping the patient reach an informed decision fairly with respect to the treatment to be given. In order to obtain an informed decision, three elements must be determined. 1. Free will. The patient wills without coercion or on-site pressure. 2. Information. The patient must receive all of the information regarding his condition and the proposed treatment, including alternative treatment, side effect, and the effect of not receiving treatment. 3. Competence. The patient must be competent to make an informed decision. The obligation of the patient is to strictly adhere to the rules of informed consent. As part of the autonomy and respect he is obligated to his patient. Therefore, the patient must always consider the personal characteristics of the patient, such as Siti, his special peculiarities, as much as such exist in his unique personality, and relate to it by providing the relevant explanation. One of the challenges facing the medical staff is providing its patient with appropriate information. Okay, this is my opinion. Thank you for watching.